All right, good morning, everybody. Thank you for joining us for our quarterly meeting of the Palmetto Vision Alliance. Looks like we've got a full house today, which is great. We'll be able to hear an update from our 37 Gears partners that are helping build the website for the Palmetto Vision Alliance. That, of course, has been one of the main focuses of this group since we started was how can we make all of our services more visible and accessible to those that might be searching for them, and also how can we create a platform where we can better educate South Carolina about the prevalence of blindness and vision loss and what we can do to create a better and brighter future for South Carolina as it relates to the field of vision and eye healthcare. So all of that will be coming to fruition soon. We're very excited. These are projects that are made possible by funding from the Blue Cross Blue Shield of South Carolina Foundation. So we'll definitely give a good tip of the hat to them as we move forward with this. But I did get an update from our associate at 37 Gears that their previous meeting is running a little late. So we will divert to the second part of our agenda and focus instead on revisiting the Palmetto Vision Alliance working groups and our open time for discussion. So, sorry, give me just 1 second. Okay. So with that, we can start with our time for having a sharing space to talk about what our needs and priorities are, what resources we need, and any upcoming events or programs that we would like to promote. So does anybody have anything that they would like to share there? Feel free to just take yourself off of mute and jump right in.
Daniel, I can go. This is Tammy Wallace. I'm with the South Carolina Assistive Technology Program. This is actually my very first meeting joining the Alliance, so thanks for letting me be here. I just wanted to let everyone know that we are doing a best practices for professionals and in the community for choosing a video magnifier for individuals with low vision. And those dates are June 7th and June 8th. June 7th will be for practicing professionals, and that session is from 1 to 3 that day here at the Assistive Technology Program. And we will have a speaker. She has over 30 years experience working in the industry, and she's going to bring all the different types of magnifiers with her and kind of walk people through the differences. And then the second day on June 8th, we're actually doing a 1-hour community session. And then we're going to also have 30-minute appointments available all day where people can meet with her individually for 30 minutes and actually try things out and talk about their specific situation. So I'm working on flyers right now, so Daniel, I could send those out to you, and then you could send them out to the group if they want to help promote.
Absolutely. That would be great, Tammy. We have a semi-regular newsletter that we send out when we get kind of a critical mass of updates and events that we can share. So please send that over. We'd love to get something out before the end of this month. That'd be great.
Okay. Okay, great. Thank you.
Absolutely.
I have something, Kay Hightower from the South Carolina Department on Aging. One, a message for Courtney that thank you so much for applying for the Elder Care Trust Fund. Those grants should be awarded in the beginning of June for that. So I want to just let you know. June is, what did you say, Courtney?
I said, thank y'all. Yeah, we're excited to hear about it.
So I just wanted to let you know, and submitted, and so they're with the evaluators now. To want to thank Tammy for being such a phenomenal partner. The Department on Aging and Assistive Technology And Walton Options has a really great disabilities pilot going on in 2 communities in rural South Carolina, Blackville, the town of Blackville, and the town of Edgefield. And this is to help people who are socially isolated because of their age in nursing homes. Even though we're the Department on Aging, we work with people with disabilities. And so we're just so grateful for the partnership that Tammy and Rachel and the folks at Assistive Technology. So I want to share that. And then also June is Elder Abuse Month, World Elder Abuse Month, where we're raising the issue of elder abuse. Sorry for all, I see Daniel smiling about all my commercials. And there is going to be a big walk across the street from the commission, Karma, at DSS. It is going to be a big walk to highlight the issue of elder abuse. Unfortunately, there's a whole lot of elder abuse in South Carolina. And one of the things that we found that's such a big problem with people with vision impairments, because they they're vulnerable. If you're wearing glasses or if you have a cane, seniors who they cannot watch their stuff. So if any of you is interested in joining, it's called WEAD. It is a task force, an informal task force of nonprofits and state agencies. If any of you are interested in joining WEAD, let us know. We would be happy to have you be a partner. DSS is a partner. AARP is a partner. SCVAN, that's Victims Assistance, the Attorney General's Office, the Alzheimer's Association. There's a whole kind of hodgepodge of groups. Office of Rural Health is involved. If anybody's interested in joining the WEAD team, right before June, we meet virtually a lot because that's WEAD month. But during the year, there's not a lot of meetings. And again, it's really informal, but it's a really great way, like this group, that different state agencies and nonprofits can work together and forge alliances. And sometimes you don't even know where the alliance and partnership is going to go. So if anybody is interested in walking, because it is across the street from Karma's office. So I'm saying that again, if she's interested in walking, we'll be going around the Firefly Stadium. And thank you, Karma, personally. So you know what I'm talking about. And it's funny, it's great because Karma and I have known each other for years and we've never seen each other. So this is really, really, really exciting. So thank you, Daniel, for allowing me to do the commercial.
Happy to provide the platform. Thank you, Kay. And if you've got a quick write-up of that we could include with a link to your contact information for how folks can join, we'd be happy to send that out to the membership as well.
Great, thank you. Will do.
I have a question for the group, if that's okay during this time.
Absolutely.
We are getting more and more calls. I think in the last month, I've probably gotten 3 or 4, which I don't know if that sounds like a lot to you all, but it does to me, from patients who are eligible for Medicare and Medicaid after the age of 65, but cannot afford it and are kind of stuck in that weird limbo. And because they're eligible, we haven't necessarily at Operation Site covered them before for that age group, unless they're not a US citizen. And just wondering if you all are also coming across that more often, or if it's just kind of something for me. And I have been referring them to other providers because of that, and you all. But just wondering if there's this gap that we as an organization aren't aware of or aren't filling.
That's a great question, Taryn, and I would defer to Wynn as to what exactly we've seen at Lions Vision Services, but I know we do serve a number of clients that are over that 65 age, so they would be eligible, but there's still valid financial need, and they either aren't covered under vision or they still lack the financial resources. So we look more at the total financial need rather than whether or not they're enrolled in Medicare or Medicaid. Wen, do you know how many of our clients last year were in that over 65 age category?
I would say at least 10. I don't have that
Yeah. So yeah, I mean,
spreadsheet open, but a lot of them, like she said, they can't afford it. They get their Part A, but they can't afford the supplemental pieces. And then some of them just people don't understand, and then they don't sign up for the supplemental, and then they're charged a penalty if they try to sign up later. Then they really can't afford it. So I think some of it's not being able to afford it, and some of it's not understanding the process in the beginning.
Yeah, I do know there are some zero options for people if they sign up, right at the time when they're supposed to. They just really have to be working with an agent that understands all the supplements and are willing to offer those, because an insurance agent isn't going to make a lot of money off those plans. So sometimes they don't mention them, but they are out there.
Are you familiar with the Healthy Connections Prime program, which is a good resource? Those are people who qualify for Medicare and Medicaid, where you have a Healthy Connections Prime advocate on behalf of the people in those programs. That's by the Department on Aging. Also, for anything above the age of 65, I would always look at the AAA for whatever county you're looking for that has coverage, because whether it's through our direct services or the Department on Aging's direct services, which is food, home delivered meals, congregate meals, transportation, home care services, all of those which we give to people with disabilities and seniors, that we have all of those things. Then in all of our departments, we have something called information referral, and that's to refer outside of the network to partners. So Taryn, my number will be there, but it's the Department on Aging. We're state dollars. We're a delicious department because of the Older Americans Act. We do not care how much money you make. We are not allowed to look at a person's income. So, and I think that's a unique thing about the Department on Aging and Aging Services and everything that's funded by the Older Americans Act. So I'll definitely have my name in the chat if you want to chat about seniors, because I do think the Department on Aging is a good catch-all resource.
Thank you, Kay. I appreciate that.
Awesome. I'm always glad when we can pose those questions to the group and get the collective knowledge base of all of our members helping each other out. That's one of the beauties of this coalition. So we thank everybody for taking the time to do that. We'll save some time to come back to this at the end of our meeting if there's other questions or updates that folks didn't get a chance to share. But I want to be sensitive to the fact that we do have an hour, and our primary focus today is the website, and our account executive with 37 Gears, Jessica Garrett, is with us now this morning, and we're really excited to hear more from her about where the website stands in terms of development, and also the efforts that have been made and the design that is being put in place to emphasize accessibility. So I won't take any of Jessica's thunder with that, but Jessica, thank you, and thank you to the team at 37 Gears for just being stellar partners with us to help get this ball rolling and to get this project underway. And I can't emphasize enough our thanks and appreciation and just our positive experience with 37 Gears throughout this entire process. So excited to turn things over to you and hear a little bit more about where the website stands.
All right, great. Thank you so much, Daniel. It's been a pleasure working with you, and I'm excited to show the group where we are so far with the website and the design. So again, I'm Jessica Garrett with 37 Gears, and I've been working hand in hand with Daniel throughout this process. And we're to a spot that we feel really great to show y'all some designs and to talk through some of the accessibility kind of factors and things that we have taken to get these designs so far. So I'll go ahead and share my screen. What I'll do is go through a quick presentation that just outlines certain things that we've discussed, and then I will also show you the page designs. Can everyone see my screen?
Yep.
Okay. So just a quick agenda for the things I wanted to cover. We'll go through the project goal, the architect for the website, the design proofs, and then some milestones and next steps. At any time, if you have any questions, please feel free to jump in or post them in the chat, and we will definitely discuss them. So the project goal, when Daniel and I started with this, we went through a whole exercise trying to determine some objectives, the goals, the outline of the website. And so we decided to design and develop an accessible website for Palmetto Vision Alliance to better serve its local organizations and individuals who are blind or visually impaired by providing resources and connections. So how are we going to do that? We're going to expand the digital footprint with local services, special initiatives, resources, and connecting with its members. So our process here at 37 Gears is tailored to every customer, every client that we have, but we go through a discovery phase for several weeks and months. That's what Daniel and I have been in since the start, really in like October, November. We went through, we talked about the audiences that would be visiting the website, what they would be looking for, what some important features or services or tools that they would need, along with the ADA compliance and tools that low vision or blind folks would be using. So then we went into architect, and that's how the site is built as far as it's like a site map or an outline for the website. And then we go into design, and then we build and deploy. So I'll take you through a few of these architect and design stages. So the first thing after we did a deep dive into who the audiences are and the different people visiting the website, we go through what we call an information architecture, and that's the structure of the site. And the goal is to classify the content in a clear and understandable way and to arrange it so that it makes sense to people that are there. It allows the users to find what they need in just very few clicks with very little effort. So we take the website, we break it up into your users, those are your audiences. We break up the content to outline what is needed and how it fits in any existing structures. And then we also look at the context, and we want to make sure that it supports your site goals. And then that turns into this information architecture or site map. And this is basically the outline of the website. And on the designs I will show you, but the eyebrow is what we call, it's like the top navigation. Then we have the main navigation, which is broken out into home, about us, special initiatives. You'll see the drop downs under about us and special initiatives. Those are pages, resources, and contact us. And then in the footer, we outline a few things for the footer. So I just like to show this so you can have a big picture of what the website is supposed to look like before we go into the design. So our ADA compliance process, how do we get to where we are with things? How do we know some of this information? A lot of people ask that. So I wanted to go through what we do here at 37 Gears. We've done lots of research, not just for y'all, but for other clients, but it's specifically now with y'all for low vision and blind folks of how exactly they navigate the websites and what's important. We attended ADA webinars, and we've also connected with Able SC several times. I've been working with Sarah, and she's been wonderful. So we have a great partnership with them as well. They've given us some great feedback and helped steer us in the right direction. So what we want is the designs, programming, and ultimately the overall experience for these folks to be our priority. So how do we do that? We started with a new logo for Palmetto Vision Alliance. We picked a color palette that is specifically for low vision users. So not only the logo, but also the rest of the colors on the website. We did some testing with those. We also chose a font type that is specifically guided to those to reduce visual stress and improve reading performance. Our designer did a lot of research on font choices and decided on a certain one. We took the main navigation. Again, those are your buttons kind of across the top of your home, your about, services. And we listed those in what, after working with, again, Able SC, what they would consider the most important pages. And we put them in the appropriate order across. So when their screen reader goes across it, it gives them the most important pages first. And then we also have done some other things just on the pages themselves with designing and programming, keeping, again, the users in mind. So keyboard navigation, alt text on images. We'll be adding headings to all of the pages, so H1 through H3, and the correct labeling. Text spacing is really important. Drop downs and lists, instead of just having a graphic, we'll include drop downs or lists of those items. I'll show you an example here in a minute of a map of South Carolina with counties. So while we do have a visual map for some folks, we also will have drop downs and lists of those counties. Color contrast, again, is very important. Consistent navigation across all of the pages, and then consistent identification of icons, buttons, and images.
Jessica, if I, while we're on this slide, if I could also extend our thanks to the South Carolina Commission for the Blind as well. I think it was Chris from their team that was on one of our initial meetings with Sarah and Able SC to talk with us about their recent web design process and other accessibility concerns that we needed to take into consideration. So in addition to Able SC, which has been phenomenal to help us with this, Commission for the Blind as well, we thank you all for sharing your expertise in the process.
Definitely, yes. Thank you for bringing that up as well. So we've worked with a variety of other folks that have helped guide our direction for this, and it's very appreciative. So now I'll switch over to the design proofs themselves. I'll be showing you a handful of pages. Now, none of these are final. You'll see that we don't have text outlined on all of them. We use Latin just because Latin is the closest to our language. So you will see some pages have Latin still blurbs in them, but Daniel is working just hard on getting that content ready. It's a big project, so we appreciate his effort on that. So I will go through these proofs with you, and again, nothing is final. If there's anything that just kind of sticks out to you, or you want to share your concerns with Daniel, then that's certainly something we can take into consideration. So this is the home page. Again, these are iStock images. We will go through, Daniel and I, and verify which images, should be used, but we just have them as placeholders right now. So across the top are your search and your find services. Find services, we think, is one of the top things folks will be doing on the site. So we wanted to make this button stand out and be at the top for screen readers. And then you have your main navigation here across. This is a PDF, so it is not clickable at this time, but if I were to hover over special initiatives on the website, a drop down would appear with those additional pages. Same with About Us. So as you scroll down the page, you'll see the different icons and directions for the site. These would take you to different pages. And I'm going to show you a screen as well of what kind of the back end for things would look like for these headings and labeling for our low vision or visually impaired folks using a screen reader. So here's a Find the Support You Need area. And again, I will show you specifically this page, kind of an awareness call out area, and another Find Your Services in your area block, a stat area, and then the special initiatives. And then here's where we want to add a quote. And then your footer. The footer will be standard across all pages, along with the navigation at the top. So I'll scroll back up just to give y'all another look at it. But again, this is the home page. So when users come to the website, this will be the first page that they see. So here's what it would look like for my team when we're programming it. So we would put in the different headers, as I said, and this is very important for screen readers. It allows them to see what information is considered important as they scroll down the page. And it also provides the alt text and kind of the definitions or explanations of things. So we would add alt text to the photos and to the icons here. And again, adding those headers. Some more labeling. So this is something that will be done on every page of the website. I just wanted to give you an example of what the homepage would have. So this will all be done, again, in the programming phase of things and making sure that it is all screen reader set up, and that these headings and labeling are all done correctly for them. Next is the About Us page. So here in the navigation, if you were to click home, you would go back to that home page. But if you click About Us, then it will take you to this page. So again, we're hoping to space them out correctly and accordingly to the ADA guidelines using larger text fonts here. A what we do section and a join button. And all of our buttons, we try to label them correctly as well. We don't want to just say learn more. You want to have more descriptive text so the screen reader knows where it's going to take them. Again, the colors, we researched low vision colors and landed on these blues and yellows. So next, under our About Us is our members. So if you went to About Us, under the drop down, it would be Meet Our Members. And this is repeating because we're not there yet with all the different members, but they each would have a logo and text underneath that would be clickable to take them to their own individual page. So again, this is just repeating, but these would be each different partners or members. And when you clicked on one of them, it would take you then into their own page that would introduce them, give them a blurb, some information, and then the services that are offered. And then the last set of pages I'm going to share with you is Find Services. This can be gotten to from, if you click on the Find Services button up here in the menu, or different from the home page, different call out areas for find the services or support you need, or through the map on the home page. So this first one has a search by zip code or filter by service type. And this is an example of one of the drop downs. So you could click on these and then it would filter below for you. And I will show you that page. There's also a button right here that's a little bit hard to see because it's covered up by this box, but it has the open map view. And then that would take you to a visual map page. So I'll show you that page as well. So once you click on one of these, it then would provide your search results underneath. So this would still all be on the same page. And it provides the search results for whichever service type you selected. So these are filtered by search or service type or zip code. And it provides all the information. And then here is if you were on that page and you clicked Open Map View, this is what it would show. So our folks that do want to visually see a map, then they could click on a county. It would outline it. And this one is Horry County. And then it would provide the search results below. So those are the different ways folks that are visually impaired or have or sighted individuals will be able to view the Find Services pages. And again, all of this will be labeled in the back end with your H1 through H3 headings, icons, things like that, a description of the photo. These will all be labeled. Those were the example pages that I wanted to show. Are there any questions or comments about those before I go into kind of next steps? Okay. Let me get back over to my other screen. Make me go through all of it. Sorry, I clicked the wrong button. Let me get there. All right, so next steps. So as I mentioned, Daniel and I have been working together since about the fall of last year. We've gone through the discovery phase, which has been completed. That was the logo creation with the brand guidelines, information architecture, and audience personas in your discovery. And then we went into architect and design, and that's where we are as of right now with these designs to you. Daniel and I will be working together on the content development to fill in the rest of these pages. There are still a handful of pages like the resources, the contact us page that will need to be designed. And those are coming next. So we're in the phase of design, and then we will move into the phase of build. We'll build the site, and then we also do what is called a content management system. And that allows Daniel or anyone on the team, myself, to go in and make changes very easily to the website. It's called the back end of the website. So that would be hooked up as well. And then I would put in all of the content that is still needed. I'm hoping this could be done in June and July if we can get the rest of the designs done and approved. And then we would move into the deploy phase, which would be mid to late summer. We would first do testing. Daniel and I would do internal testing. I'm hoping we can do some testing with Able SC. And then we would schedule a launch date. So that's where we are with the next few months of things. So I can see the light, and I can see the end of the tunnel here. And it's been a great process so far. And I've really enjoyed working with Daniel and the team. So thank you very much. I'm happy to answer any questions, or if you have comments, we can go through those, or if you'd like just to send them directly to Daniel, he can share them with me as well.
Yeah, thank you so much, Jessica. Really appreciate your time and expertise in helping bring all this together for us. And I do want to give some time for our group to offer some feedback, any initial thoughts that you all had as you were looking at what's been designed and structured and set up so far. If you have questions or comments or concerns, we would love to hear those now. We as a whole group will not meet again, as you see in the timeline, until hopefully after the site is launched. So hopefully at our next Q3 meeting, we'll be able to quickly show you the finished product and provide kind of an overview of how it's doing, once we deploy it. But there are a couple of things that we really need your help with. So before I do open it up for questions and feedback, I want to ask specifically if all of us can help with a couple of things. Number one are images. You've heard me ask this before, but we really, Jessica and I really need your help. If you have images of your organization in action in providing services or doing the things that you all are doing day in and day out, that you would be willing to share for use on the website to help us fill in some of the graphics. That would be a huge help. We would prefer to limit the use of stock images as much as we can. But at the same time, we're going based off of what we have. So if you could help us with that by providing high quality images for the site, we would greatly appreciate that. When I send out the next group update, I will include a link to the Word document where we've drafted out all of the organization descriptions that you saw kind of in demo form today with Jessica. And in essence, those are in their current form, basically just your mission statement and kind of a succinct overview of what services you're providing in the state. So take a look at that. It's your organization. So if you want to tweak that or adjust that, please let us know as soon as possible so that we can make sure there's minimum delay time with the 37 Gears team so that they can get those web pages built. There is a spot on the main page for member testimonials. So we would love to get testimonials from you all about why you are a part of this group. Most of you are consistently dedicating an hour or two a quarter to participate in these conversations and to engage in these dialogues. So your time is arguably your most precious commodity. So why do you make that time commitment every quarter? What's the value that you're getting out of this? What are your aspirations? There's a lot of things that we are still working to get traction with our group here. So what are your hopes for the future? Any testimonials of whatever length you can provide, we would love to have those, and you can send those directly to me. And we have service data for most of our members, but I think there's a few that maybe did not complete our service inventory survey when we first put this group together. So if you have questions, if you're new to your organization and don't remember if you all completed that survey, that's how all of the services on the site are going to be populated. So that's the reason that we collected that data and are now using it. So if you have any questions or doubts about that, please get in touch with me so we can make sure that your services are part of the website. So those are my 4 requests that we would ask for your help with moving forward. And with that, I'll leave a couple of minutes here for questions and feedback to Jessica and the team.
This is Courtney with ABVI. I just want to thank y'all for all of your attention to accessibility and usability. You can tell y'all put a lot of work and thought into that, and I truly appreciate it.
Thank you. You're welcome. We have, and that's something that's important to us, and just giving the users the best experience as possible.
Is there any other feedback or any other questions or comments for Jessica while we have her here?
Okay, well, I appreciate the time. Thank y'all all so much. Daniel, I can share any of these, the PowerPoint or the proofs with you. And if anyone would like to see those additionally, feel free to send them out. And I look forward to getting the website launched in the next few months.
Awesome. Thank you so much, Jessica. We
Thank
appreciate
y'all
your
so
time.
much.
Yeah, take care.
Bye-bye.
So one of the components that you all saw in that webpage were the various working groups that we have in the Palmetto Vision Alliance. And the 3 that we identified when we got started were strategic planning, advocacy, and community outreach. And we have had a hard time getting traction with those in large part just because of needing to identify a leader that could really take the initiative and get those groups up and going. Particularly the Strategic Planning Committee. I mentioned the funding from this website project is coming from Blue Cross Blue Shield of South Carolina Foundation. It's part of a 3-year grant. The first 2 years are covering the website development, which will be launched later this year. The 3rd year, there will be some funding available for strategic planning efforts specifically, whether that's hosting listening tours around the state or engaging a consultant or whatever it might be. I know that one of the things that we've wanted to do with this group from the beginning is really coalesce around a statewide strategic plan for vision and eye care in South Carolina. So we need somebody to really help lean into that. advocacy and public policy. I hated that I had to miss it at the last minute this year, but ABLE-SC's Advocacy Day, and I know there's a couple other advocacy days that are out there that are elevating the legislative issues and public policy initiatives that we can implement. We want to provide a space for our members who are able to do that. We understand not everybody can, and that's okay. We're very intentional about disclosing not all of our members are engaged in advocacy because we know that some of you can't do that. But for those who can, we want this to be an effective platform to elevate the voices like ABLE-SC and others that are in this space on a regular basis, and particularly address issues related to eye care. And community outreach is just building awareness. We feel pretty confident we have most groups in the state represented in this alliance, but really helping to better engage on a statewide basis to increase awareness and outreach is vital and essential. So we really are looking for somebody in the group to step up and to lead one of these working groups, and for us as members to recommit to engaging and participating in those. So ideally, conceptually, these working groups would meet for about an hour in between our quarterly meetings. So it would just be one other meeting once a quarter. The individual working groups would be free to decide, what that schedule would be and if additional work was needed. But I will be sending out a survey for folks to recommit to being a part of one of those working groups, and specifically asking for leadership in those working groups. So I won't put anybody on the spot now, but if anyone feels moved to take on one of those leadership roles and would like to share that, we would love to be able to recognize that and to move those groups forward. Is anybody in a spot this morning where they feel that one of those is speaking to them and they'd like to lean in and help? All right, well, stay tuned for the survey and please take a few moments to fill that out for us. We want this, again, to be a group that is helpful for you all. So I think these 3 areas are all things that we can improve in and do better in. So please help us to better serve you by engaging in these groups. So we'll send that out in the follow-up. Let's circle back to our discussion space and our sharing space. Are there other updates, events, or questions that you all have for the group that we can share before we wrap things up this morning? All right, well, not hearing anything, we will go ahead and give you back 14 minutes of your day today. So we've got our next meeting scheduled for Wednesday, August the 9th. Our hope is to have someone, based on y'all's feedback last year, to talk about ethical storytelling at that session. So if anyone knows somebody that is experienced there and would like to speak, please let me know. We'd be glad to engage them with that. Again, that'll be Wednesday, August the 9th at 9 a.m. on Zoom. We are working to keep the OneDrive folder for the Palmetto Vision Alliance up to date. So check that link often. That'll be in the next email reminder that goes out, and you can bookmark that or save that email and refer back to it. And of course, anything that you would like included for announcements or updates in our next newsletter, please send those to me this week if you can. I'm going to try to get something scheduled to go out the first of next week. So if anyone has something that they'd like to send, please get that to me this week if you can. And please look out for further communication. Thank you all so much for your time today. Have a good one.
Thanks, everyone.
Thank you for all your help, Daniel.
Thanks, Courtney. Thanks, Karma.